As the Africa Climate Summit comes to a close tomorrow, health experts are warning that the outcome of the talks could be futile if health is not factored in the climate debate. They're also noting that emerging diseases were not included as part of the agenda in the Nairobi talks. Here is Gloria Milimu with that story.
Health experts have warned that the nexus between climate change and health cannot be ignored. This comes following allegations that the health agenda was not included in the climate summit. The stakeholders led by the Africa CDC say 23% of global diseases are attributed to climate change. This percentage, they add, is even higher in the sub-Saharan region at 29%.
Bringing the health discussion onto the agenda of the climate change platform is essential for Africa for two reasons. One is the burden of climate-related health impact is largely felt in Africa. And the second reason is we as a continent are facing much higher risks when it comes to agricultural disruption and therefore food security.
He also emphasized the need for health funding. And now, for Africa to effectively tackle these challenges that continue to pose a threat to its health systems, experts recommend the need for a One Health approach to counter the impact of climate change on human, animals, and environmental health.
It's cost effective, is intervention effective, and most importantly, is community and people-centric.
For a long time, the three sectors are working in silos. So bringing them together to work synergistically is a challenge, and we are working on that as Africa CDC. Second is financing. There are good ideas in all three different sectors, but there is no funding that comes with, well, the funding is not adequate to be able to address the good ideas that have been developed by the three sectors together.
Even so, whereas data plays a critical role in early detection of disease outbreaks and helps inform policies that help stop diseases in their tracks, most African countries still struggle with data collection, among other challenges the stakeholders say must be addressed to ensure a unified approach to tackle these emerging and existing threats.
I think data is quite important to inform policy, preparedness, and planning, in the sense that when we can predict using this methodological data, we can do things like ensure that we have sufficient resources, thinking about things like vaccines. We have a good amount of stockpiling, for example, but in the human health population as well as in the animal health population.
As African leaders prepare to give their stand regarding climate change through the Nairobi Declaration based on their three-day deliberations, it remains to be seen whether the outcome of these talks will factor in health as part of what will be presented in the COP28 conference in Dubai later this year. Gloria Milimu, KTN News.
Okay, away from the climate summit conversation, and the government is seeking to write off all debts owed by public universities. Education Cabinet Secretary Ezekiel Machogo